Welcome. So, we will be continuing our lectures on genetics. So, our topic today is cystic fibrosis. Cystic fibrosis is basically an autosomal recessive mutation, and the problem is with CFTR gene. This is called as cystic fibrosis transmembrane conductance regulatory gene, which encodes the CAMP regulated chloride channel. So, basically, this is a cell, and in between the cell there is a chloride channel. Okay, so suppose this is a mucus cell. It produces tons of mucus here. Okay, so what it does is this is a membrane, CFTR membrane regulator. So here is a chloride lying down, and so it pushes out the chloride into the mucus. So the chloride will come and it will be embedded in the mucus. So this chloride along with the mucus will attract water. Okay, so when water will come, it will make the mucus thin, and the cilia will function properly. Okay, to remove the mucus out of the membrane. And regarding the sweat cells, again the same phenomena is there. This is the CFTR membrane, but here it is opposite. Okay, why? Because your body is excreting a lot of sweats. Okay, so in this sweat there is chloride, sodium. Okay, chloride and sodium and all. Okay, so chloride, it actually absorbs the chloride and it takes the chloride inside the cell. So if there is a problem in this CFTR gene, so chloride won't be taken inside the cell. So what will happen? Chloride will be trapped in the sweat, okay, outside the body. So you will lose chloride as well as sodium. And one thing more, regarding the sodium, there is also a phenomenon that here is a sodium channel as well. Okay, so what happens is, so this sodium is sometimes co-regulated with the CFTR gene. Okay, so sodium will also not be absorbed here. If this is not working, so sodium channel will also not work. So this way you will lose sodium plus chloride. Okay, and here you won't be able to secrete the chloride, so chloride will be trapped here. But the problem here is that you will make the mucus more thick. Why? Because the chloride won't be able to attract water, so mucus will be getting thicker and thicker. Okay, so this mucus can get infections. Okay, it will be a best site for infections, bacteria and all. And after infection it will lead to inflammation, and after the inflammation it can lead to some severe complications like bronchiectasis. Okay, and all that. Okay, now let's read which and this CFTR related, this is not a CFTR is a gene. Okay, and CFTR orders some other gene, some other transport, which is a CAMP regulated chloride channel. Now this is a CAMP regulated chloride channel. Okay, it is made by the CFTR gene. Now what happens is, it will increase the viscosity and thickness of the body's secretion, that is lungs and pancreas. And listen, the thing is that CFTR genes about the mucus one. Okay, this is all present in the reproductive. Okay, this mucus cells reproductive, and it is present in the digestive tract, it is present in the airway tract. So all those things can clogged up, okay, by the mucus. Now what happens is, you just remember that it is present on chromosome number 7, this gene. And if they ask you about the specification of the gene, so this is about the delta. It is phenylalanine, and the position of the phenylalanine genes which is mutated is 508. Now let's move further. this I have already explained. This is the pathophysiology. Okay, and let's move further. And now I should tell you the autosomal recessive. What does autosomal recessive means? Okay, so basically, suppose this is a mother and this is a father. So in mother, you get, as it is autosomal condition, so you won't be using X and Y chromosome. Okay, as it is autosomal, so sex doesn't matter here. Okay, so because sex is only used for X and Y. Okay, now we are dealing with the autosomal chromosome, which are 22 pairs. So autosomal makes up your body, like eyes, organs, skeleton. Okay, so both have, uh, there is no association of sex here. Okay, both male and female can get this disease. Now look, both are carriers, okay, in autosomal recessive. Now this A and this A, when combined together, they will form AA. Whenever in autosomal recessive, whenever in recessive disease, you get two homozygous genes, okay, two homozygous defective genes, then you will get the disease. Otherwise, if you get one capital and one small, you will be called as carrier. And if you get the homozygous two defective gene, uh, you will be called as disease. And if you get small a, then you will be normal. Okay, so now this will be the diseased one. Okay, now this will be the disease. Let's try this one. AA. Now this is a carrier. Now the second one, AA, again carrier. And lastly, when both A's combine together, they will form a normal. So you will get the questions that how overall, let's consider all those four children as 100%. Okay, now they will ask you, out of 100%, how many are there defective? So you will say 25%. Okay, defective. And how many are there carrier? So you will say 25% are the carrier. And if they ask you about the how many patients are normal, so you will say 25%. So there you go. These are all the 25% unaffected and 25% affected and 50% carrier. Okay. Now, regarding the organisms which colonizes the CF, mostly I told you when the mucus is clogged up, and it is a best site for the organism to grow in. So regarding that organisms, which are the types of organisms? So Staphylococcus aureus will be present in neonates mostly and children. Okay, neonates and children. And Pseudomonas aeruginosa will be present in teens and adults. Okay, so and these as well, Aspergillus and Burkholderia and Capaceae, which was previously known as Pseudomonas capaceae. Okay, now let's move on to features. Now, presenting feature is neonatal period. So, suppose the patient's mother will come to you, and she will say that my child has not passed meconium. Meconium is the first stool passed by the neonate. Okay, so he won't be able to pass the ileus, as I told you, that the mucus cells are present in reproductive. Okay, so his all reproductive system will be clogged up, like in a female, all the uterus. Okay, so suppose this is a uterus and this is a fallopian tube. So all these mucus will be clogged up here. So there will a sperm will be unable to cross the uterus, and here all the fallopian tube might be clogged up by the mucus. So she will be subfertile. Okay, because sperm won't be getting there. If she, and the male as well, male have sometimes absent male have sometimes absent vas deferens. Okay, and again the mucus production is not there, but mostly the congenital absence of vas deferens is there. That is the main cause of male fertility. Okay, but female is subfertile, as I told you, because of the clogged up organs, reproductive organs. Now, the mucus was present in reproductive organs, I explained. Now the mucus present in GI, gastrointestinal tract. What happens is that I told you that the mucus will be so much in the intestine that the patient or the neonate won't be able to pass the stool. What happens is the first stool will be clogged up there, and after stool, so stool is present over there, and he is unable to pass stool. This stool will uh, accumulate more and more and more. After that, it will press on the intestine, okay, and peritoneum. So after a lot of time, it will be there will be some staph aureus infection, okay, because it would be very good site for the bacterial infection. Why? Because of the stool plus mucus, okay, and this staph aureus will proceed further to cause peritonitis, and this peritonitis is a surgical emergency, okay. There will be and if suppose the abdomen just perforates and there is rupture, abdominal rupture, so that can lead to septic shock. Yes, septic shock. There will be tachypnea, tachycardia, all those things, okay. Hemolytic shock will be there. Now hypovolemic shock, so there will be less prolonged jaundice, okay. Now about the third, the mucus is present in the third area, which is called as, one is reproductive, one is GI, and the third one was airway, okay, like the lungs. So you will get recurrent chest infection, I told you. So your all bronchi will secrete mucus, okay, and mucus will be thick and thick. So you won't be able to attract water there because you cannot excrete the chloride out of the cell, mucus cell. So first there will be accumulation of the mucus, then infection, and then inflammation, and then destruction. And this destruction will lead to permanent dilatation of the bronchiole, which is called as bronchiectasis. Now, the malabsorption, again, I have already, failure to thrive. What happens is, suppose this is a stomach, okay, and there is a pancreas. So pancreas releases a lot of pancreatic juices into the duodenum. So because of the mucus, it will clog up the all the canals of the pancreas. Okay, so pancreatic enzyme won't be able to come out. Okay, so now here the fat is coming. Fat along with fat soluble vitamins like A, D, E, K. So these won't be absorbed by the pancreatic juice. Why? Because pancreatic juice cannot come out. Now they will be clogged up here and they will start inflammation over there. Okay, they will start inflaming all the pancreas, and they will start self-digesting itself, okay. And you won't be able to get so many nutrients, okay. So what will happen? You will fail to thrive, and you will remain with a short stature. And because of the lack of the stool, there will be a lot of a lot of fats in the stool, which is called steatorrhea. And because of the destruction of the pancreas, you will get diabetes mellitus. And one thing more, because here you have liver, okay, you have liver. In liver, you see that it secretes bile. So the bile area will also be clogged up, okay. So this will be having backflow, and now because the bile will get concentrated and more concentrated, after that it will be a good site for infection. And after the infection, pseudomonas aeruginosa can grow here, and then it will lead to inflammation, and after inflammation it can lead to biliary cirrhosis and cirrhosis, okay. So it will end with cirrhosis and biliary cirrhosis and all that conditions. Now after that, so your pancreas is done, okay, your pancreas is done, diabetes mellitus, steatorrhea. One more thing, because of the lack of the A vitamin, you will get hypovitaminosis A, okay, or A vitaminosis A, okay. So what will happen? This A vitaminosis A, because of the lack of vitamin A, you can get metaplasia in the exocrine glands, like pancreas. Okay, so it will further damage the pancreatic tract. Okay, now delayed puberty. Why? Because you don't have that nutrients, and whatever you eat, the child will eat so much. Okay, why? Because he will be hungry, and he will lose so much ATP fighting with the bacteria, but he won't be able to digest it properly. Now, rectal prolapse. Why? Because of the bulky stool. This is why the neonates cannot pass stools, no, or meconium. Now there will be nasal polyps as well. Okay, I told you there all the problems will be um, in the mucus related problem will be in the GI tract, in the airway. Okay, in the airway and the reproductive system. So male infertility in males because of the absence of vas deferens, and in female there will be subfertility. Okay, there will be infertility, not sterility. Okay, because he can produce sperm, he cannot get them out. Now diagnosis will be uh, in the UK. There is neonatal screening test for CF, which is called as Guthrie test, heel prick test. So basically, the patient heel, the baby heel, is just pricked, and chemical is taken out, which represent the liver pancreatic damage. Okay, and it is just done within 7 to 8 years old baby. After that, we prefer sweat test. Okay, if he is older in age. Now, confirmed by the sweat test. Whenever they try to ask you what is the test in neonates, you will answer Guthrie test or heel prick test. Okay. If they ask you in adults, you can go with the sweat test. Okay, it is not done. The heel prick test is not done in adults, and both can be done. The genetic testing can also be done, and the sweat test you quantify the chloride ion amount, which is which if more than 60 millimole per liter can lead to the diagnosis of cystic fibrosis. Okay, now so these two tests you don't have to forget: sweat test, Guthrie test, and genetic testing. Now, many patients are diagnosed in the childhood, but 5% of the child are diagnosed during 18 years. Okay, one thing I just missed. So neonatal periods, almost 20% of these they have features around neonatal period, and recurrent chest infections are mostly present. Okay, so that's why most of the cystic fibrosis patients they will present with the recurrent chest infection. This is more common in these people. In male absorption, I told you the vitamin, the fats, and all those diabetes mellitus, steatoria. Now moving forward, let's discuss about the management. Management is the multidisciplinary. Okay, there are many things. First of all, there is no cure. Okay, but treatment can be ease symptoms. Now we are trying to ease those symptoms that the patient is having. Okay, so the first thing we're gonna do is we're gonna give him long-term azithromycin. Okay, which will help him fight the bacteria, and then we can give him hypertonic saline. Okay, we can also give him some expectorants, or we can give him um, some objects like acetylcysteine to dilute the mucus concentration, or okay, make it less viscous, and salbutamol for bronchodilation, and lastly, lung transplantation might be needed. Okay, if it worsens more. Okay. Now, pancreatic enzyme replacement will be given. Where soluble vitamin supplementation are very important. So these things will be given. This is easy to give. And airway clearance techniques such as chest physiotherapy. So this is also good, but short-term benefit. Okay. First, you need to dilute the mucus. Okay, then you should go for the more procedure. The life expectancy is 42 to 50 years. After that, most of the people die. But in underdeveloping world, it's quite less. Okay, and 80% of the people die with lung problems. Okay, that's why I told you it's 40% common. Now, key points is regular at least twice daily chest physiotherapy or postural drainage. Okay, you have to you don't have to lie him down, you have to get him up, so gravitational force or by the posture it comes out. If you lie him down, so that his mucus won't be able to come out. Okay, deep breathing exercise are also useful. So you will give him high caloric diet including high fat intake. Before it was recommended that you should give him low fat diets, but nowadays it is the standard recommendation that you give him high fats with along with the pancreatic juices. So that will help him to digest more fat, and he will be able to recover more ATPs from that food. Okay. Now let's move forward. Patient with the cystic fibrosis try to minimize contact. Most of them are 6 feet apart from anyone. Okay, even from the cystic fibrosis patient itself, they should remain 6 feet apart from any person in the room to prevent the cross infection. Okay, like this one. Okay, Burkholderia complex or Pseudomonas aeruginosa. Okay. Now, vitamin supplementation is very important because I told you ADEK will be deficient in this patient. Now, pancreatic enzyme supplements taken with meals, as I told you, and you will give him much fatty food and much more food. Okay, heart and lung transplant. Now, this is a very important drug, which is called as lumacaftor and ivacaftor. What they do is they to treat cystic fibrosis who are homozygous for delta F508 mutation on chromosome number 7. What they do is lumacaftor increases the number of CR. So this is a protein, okay, which is defective. So what it will do is lumacaftor will come here. Lumacaftor will come here, and it increases the number of CFTR protein that are transported. Now it will order the RNAs, etc., and it will try to increase the amount of CFTR gene. CFTR gene. Okay, it will increase the CFTR gene. But in ivacaftor, on the other hand, what it will do is it will increase the probability that defector channel will be open and allowed to run. Now this will give some support to the CFTR gene, and it will open the channel. Basically, it will open the channel to let chloride out of this cell, okay, into the mucus. So it will let the chloride out of the cell. It will open. It will produce much more CFTR gene protein. It will help produce, and ivacaftor will open the channel to let the chloride ion go into the mucus. Okay, so chloride and mucus combine together can attract more water, and the mucus will be washed off. So increasing probability that a defective channel will be open and allow chloride channel ion to pass through the channel pore. So what will be the complications? So complications are diabetes, I told you, cirrhosis, respiratory failure, or bronchiectasis. Okay, so I guess it's the complete. Okay, if you have any queries, you can comment below.